Welcome to the Department of Radiation Oncology. The purpose of this DVD is to give you a better understanding of what to expect and what you need to know about your care and treatment during the coming weeks. The Department of Radiation Oncology at New York Presbyterian Columbia University Medical Center was established in 1986 and is accredited by the American College of Radiology. We offer the latest techniques in the delivery of external beam radiation to treat many different types of cancers.
When a patient comes to our department for the first time, they're scheduled for what is called a consultation. This is essentially an in-depth interview during which the patient describes their medical condition, their medical information is reviewed, a complete physical examination is performed, and a plan of action is created for the patient. Once the patient decides to get their treatment here at Columbia, the next step would be a simulation, which is in essence a fancy name for a planning session. During this session, the radiation oncologist determines and maps out the specific area that needs to be treated. At the end of the session, we place tiny permanent skin marks at the site to be treated, called tattoos, which we use during treatment to ensure that the patient is positioned correctly for treatment. Much more detailed information about this is included in our patient information packet. During treatment, patients are evaluated on a weekly basis. During this time, the attending physician meets with the patient, evaluates them to assess their tolerance of treatment, makes any additional recommendations as necessary, and this is also the opportunity for the patients to ask questions.
Well, we have a weekly reevaluation meeting, so prior to the doctor entering the room, first the nurse will see the patient, and then we'll go out and we'll talk to the doctor and we'll say, the last time I spoke to the patient, or even at this moment, the patient was telling me that they're having difficulty eating, and we'll come up with a plan on what they can do to help increase their appetite or at least maintain their weight while they're getting the treatment.
Once a patient has finished treatment, he or she will return to see us in approximately 6 to 8 weeks for what we call a follow-up visit. During this time, the patient is evaluated by their treating physician to determine their tolerance to treatment as well as their current status. The need for future visits is then determined by the attending physician.
At the turn of the 20th century, doctors discovered that by delivering high levels of radiation to the site of a tumor, cancer cells stopped growing, and in many cases were destroyed. By carefully targeting the area and spreading the number of exposures over a period of time, there was a reduced risk of damage to the surrounding healthy tissue. Radiation can reduce the possibility of cancer's return after surgery or chemotherapy. It is also effective in lessening pain and discomfort by shrinking tumors that may be affecting your quality of life.
Radiation therapy is a clinical process which utilizes high-energy X-rays for the treatment of cancer. These X-rays are very similar to what you see when you go to get a dental X-ray, for example, and they're similar in properties to light, but there are some substantial differences which make them unique for the purposes of radiation therapy. They have a very low wavelength, which means they have a very high energy, and this gives them the property that when they interact with your tumor cells, they're able to actually potentially stop the action of those cells and prevent the growth of these tumors any further.
Radiation oncologists recommend radiation in different situations. For example, if there's a tumor that is localized and we are trying to offer definitive treatment, that's one scenario in which we offer radiation. Sometimes we offer radiation after surgery or sometimes after chemotherapy in order to reduce the likelihood of recurrence. And sometimes we offer radiation to either alleviate or to prevent symptoms such as pain or bleeding. One question that I often get asked is, how do you determine whether or not radiation is the appropriate choice at this time? And there are many factors that we consider in making that determination. For example, the type of cancer, the patient's stage of disease, their overall health, as well as their age, for example.
In radiation therapy, there are two forms of X-rays that are used typically. One is when the X-rays are made to be directed towards the tumor and they're coming from outside the body. And this is typically based on the use of a linear accelerator, which is a highly sophisticated machine that was specifically designed for the purpose of radiation therapy. Here, the X-ray beam will pass through some layers of tissue in order to get to the deep-seated tumor. After this radiation is delivered, the patient can leave the room and the X-rays start acting on the tumors right away. Many people ask if they are going to be actually radioactive after this treatment is received. The answer to that is no. When patients receive external beam radiation therapy, they are only in the room for the time that the X-ray machine is turned on, and then they leave the room. When they receive brachytherapy, when they receive high-dose rate brachytherapy, the radioactive seeds are only in the patient for the time of the treatment. When they receive low-dose rate brachytherapy, then the seeds are actually placed in the patient for a specified amount of time, and over time the source activity actually starts to fall off in an exponential fashion.
A radiation oncologist is a doctor who uses radiation to treat patients, and these are typically patients with cancer. I'm often confused with a radiologist, who is a physician who interprets radiographic images such as X-rays or CAT scans. I'm also sometimes confused with a medical oncologist, who is a doctor who uses chemotherapy in the treatment of cancer patients.
They may exhibit some skin reactions or side effects related to the radiation. So we may talk about what site reactions they may experience. We also aid the physicians in treating any reactions they may have from the radiation therapy.
As a social worker for radiation oncology, I provide counseling to the patient and family. I advocate for the patient in dealing with the complexity of a medical setting. I provide transportation, education, information, and referral.
The social worker and I, we have weekly meetings where we discuss all the patients who are getting radiation therapy. And if there's any issues, or if I feel like a certain patient may be apprehensive about coming to her, we may meet with that patient together, and hopefully that'll facilitate in meeting the needs that the patient may have.
The radiation therapists assigned to your treatment team will work with you on a daily basis, positioning you for the administration of radiation. They are responsible for verifying your identity each time to the correct treatment plan, documenting your daily treatment in the medical chart, and ensuring that the treatment machines are functioning properly. All of our radiation therapists are licensed by New York State's Department of Health once they have completed a 2 to 4 year educational program and passed a qualifying examination.
Medical physicists are specialized consultants that are usually trained at the graduate level, typically at the PhD level, in understanding how radiation specifically interacts with tissues. And they have been trained to actually apply this knowledge in the clinic. So in a nutshell, we work very closely with a team of radiation oncologists on the one hand to transfer what they would like us to give in terms of a prescription to a mechanism of how we're going to be able to provide that plan. And then we go on to the next stage to make sure that the plan is deliverable and that the machine can actually do it. Furthermore, we do these checks, as I mentioned, very rigorously. And once a year, we have inspectors from the outside who come to make sure that our processes are following the norms and the rhythms that they should. Ultimately, our goal is really to provide the most optimum plan for our patients in a safe and reliable manner.
What I enjoy about working with the families is that I can see the way they've changed when they first come in, that they are anxious and nervous. And after meeting with me several times a week and the services that I provide for them, which is the counseling and the education and the resources, how their level of anxiety has dropped.
I like working with patients. The patients are going through a rough period in their lives. Well, some may see it that way. So I'm glad that I'm here to help make their experience a little bit easier to get through. And we tell them, repeatedly that, you're going to get through this. I know it's difficult. And then when they come back, they say, oh, you know what, you were right. I am feeling better.
What I love most about my job